This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. Traditionally, summertime is when cities like Hartford see an uptick in violence. A Hartford Current analysis finds over the last 14 years, June is one of the most violent months in the capital city. The neighborhoods that see the most shootings are the North End and Upper Albany. Now, beyond gun violence being mentioned in the news, who are the people living it, responding to it, dealing with the aftermath not just days later, but weeks, even years after a bullet tears through flesh? Director Jeff Tytler tells those stories in his documentary film, The Sweetest Land. Now, over the course of 5 years, Tytler filmed inside St. Francis Hospital's emergency room, where he saw multiple gunshot victims fighting for their lives. He follows some of those Connecticut residents in the documentary, which premiered earlier this month at the New Haven Documentary Film Festival. But the doc doesn't just focus on survivor stories. It asks questions about whether programs in Hartford to reach at-risk youth and prevent violence are effective. Coming up, we'll hear from some of the people in the film, including one of the trauma surgeons at St. Francis Hospital and Medical Center working to save the lives of residents who've been shot. But first, I want to welcome into the studio the director of The Sweetest Land, Jeff Tytler, who's also an associate professor of communication at Central Connecticut State University. Jeff, welcome to our show.
Thank you for having me.
I was curious, as someone who's been a filmmaker for some time, when did you decide you wanted to focus on gun violence?
So I don't know that happened on purpose, and I think it was an evolution. Originally, with this film, I was looking into the selflessness of our culture, finding those who will wake up at any hour of the night to help somebody. And I was looking to see if the rhetoric, if the ideals of what we believe in are actually playing out. And in that sense, I came up with the title before I actually filmed. And I didn't know, though, that it was going to be on violence and more specifically violence prevention. And that was an evolution. That was a learning process by which when you start on a road and if you stay on a road, it reveals what it needs to be. And that issue of violence prevention kept playing itself over and over again.
Explain the title of the documentary.
So in going back to that theme, I wanted to see where we were most effective, where we are taking on our largest obstacles and giving it our best evidence-based methods, methods that work. And in some ways, in many ways, if I look at the hospital system and I look at what went on there, what is the beauty of if you are injured and you find yourself in the trauma room, you are going to have a mass of people surround you. All of those people that surround you are going to be very well trained within what it is that they do. Those tasks are very well defined, and it is this dance. And even on the worst of days, that dance takes place at all hours, any hours, and it's a beautiful manifestation of what it is that can occur when a system works. The fact that all that time, energy, effort, skill, education can go into one soul, and it doesn't matter about that soul's race, their religious beliefs, their political affiliations. The objective is to save that life. That's beautiful. It's beautiful when that happens. And in many cases in the other stories that play out within the film, that also plays out. A reverend with a bullhorn, with no resources, who will walk up to a family after they lost their loved one. Nobody's paying him to do that.
This is Reverend Henry Brown.
Reverend Henry Brown, yeah. And when you film over the course of a long term, you have to see the truth. People can't act in front of you because you're seeing repetitions of things. And in so many cases, in all cases, with regard to a family that has lost a loved one, that man is out there. That man has to deal with that family, and he is dealing with that family willingly. What's troubling is if you have somebody who is connected with a family who lost a loved one, why aren't more people engaging him? And in the event that, in many cases, the state will pay for funeral services. And yet there's a disconnect from why aren't they giving him paperwork to give to that family? So that there were sort of these red flags that started to play out and these disconnects that played out. And it wasn't my intent to focus on those negative disconnects, but they kept happening. And that ability to the ability to see that, the ability to talk about that is not necessarily a bad thing. And failure is not necessarily a bad thing, because if we can talk about failure, then we can improve it. Then we don't have to be defensive about it. We can say, how do we get better?
We're going to be talking more about the themes in your documentary film. Again, The Sweetest Land. Jeff Teitler, director, in studio with me here on Where We Live. But I wanted to talk about the access that you got in filming. Some very personal moments. It was difficult to watch this documentary because you're in, again, the St. Francis Hospital and Medical Center emergency room. You're seeing surgeons working to save the lives of shooting victims. How did you get that access?
So filming occurred in a staggered way, and it seemed to have a snowball effect. And one of the first milestones was working with the Hartford police and actually gaining access with the Hartford police. So when you get the trust of police officers who are under constant scrutiny and you are embedded within the intel division. And I think when I first got there, there were police officers that said, you know what, don't get me on camera. Whatever you do, I don't want any part of this. And by the end of our working together, they were pulling me over. You got to see this, you got to see that, you got to see that. But what that led to was a few very key events, and there was one. This was in the very beginning when I was filming, and I'm filming in the North End, and there was a father and a son, and the son was being questioned, and I'm filming the son being questioned, and I look at the father, and he looks at me and he says, "Don't film my son." And the notion that what I was capturing, I had no business to capture, and the ability that footage might become exploitive, or that I was exploiting those individuals that I was filming who didn't give me permission at the time to film, that weighed heavy. And if the intent of this film is to get awards, if the intent of the film is to play at festivals, then I am guilty of exploitation. But the real intent of the film is to open up that prevention conversation, is to improve the lives of those in need.
But surprisingly, a lot of the people that you filmed did agree to have, again, these very, very personal moments when they may be close to grieving, or they literally are in pain in the hospital. Why do you think that is? Why do you think they agreed?
So I didn't think they were going to agree initially. And when you were filming somebody's most intimate moments, and families and mothers and people huddled together in the most tragic of times, and sometimes even lifting the camera was terribly difficult, because I almost felt ashamed. And yet the more I would do it, and the more I spent time with people, and the more they started to tell their stories, the more, for some reason, they felt good about it. They felt good that they could tell their stories. And I felt like I spent so many hours with so many victims hearing their stories, not only in the event of a trauma, but right after that trauma and days after, and while they're healing in the hospital. That very close bonds were formed, and that it was unanticipated, and is sort of the beauty of the film. And to really, because I was looking at the Hartford Current, and I'm looking at Hartford homicides from 2015 to 2019, and you have a big map and you have dots everywhere. Well, those dots are families. Those dots are mothers, fathers, they're friends. They're not dots. And when you you can't stereotype them when you're with people, and you also see what happens when they are released from the hospital.
One of the people we meet when we watch your film again, The Sweetest Land, is Aswad Thomas, who is a survivor of a Hartford shooting in 2009. He's joining us today from the studios at WABE in Georgia. Aswad, welcome to our show.
Hey, Lucy, how you doing? Thanks for having me.
I'm doing well. I mentioned that you now live in Georgia, but part of your upbringing was in Hartford. Going back to 2009, you were on your way to a professional basketball career abroad. What changed outside a convenience store in your old neighborhood?
Yeah, I'm from Hartford. I was born on Edda Street in the North End in the Upper Albany neighborhood. And, I grew up in a community riddled with poverty, riddled with violence. But living in that community, I never thought that I would become a victim of violence. And for me, at a very young age, basketball and my education were the two opportunities that I firmly believe would, allow me success in life and to accomplish my dreams. And so in 2009, I graduated from college. I became the first male in my family to ever graduate from college. And that moment was not just important and historic for myself, for my family, but also for the community, because I, quote unquote, made it out of the neighborhood. And I was a star basketball player, a star basketball player from the city of Hartford, who signed with a basketball agent to continue and embark on his professional basketball career overseas, where August 24th, 2009, it became the lowest point of my life when I became a victim of gun violence. Being in the neighborhood, leaving out of the corner store, on the street that I grew up on, two individuals, two young men, approached me with what I believe was an intent to rob me. And after a brief scuffle, I got shot twice in my back. Mm-hmm. And I remember waking up on that cold concrete, not able to move my legs. I was confused, but I didn't know I was shot. I immediately tried to stand up, but I couldn't. And then I felt a substance that felt like water was on my back. And as I reached behind my back, to feel what this substance was, my hand was filled with blood. And that's when it hit me that those bullets that I escaped my entire life finally caught up to me that night on August 24th, 2009.
You would later wake up at St. Francis Hospital and Medical Center, your family there with you. You would learn that you suffered 2 gunshot wounds. Tell us about the injuries, Aswad.
Yep, suffered 2 gunshot wounds to my back. The first bullet entered right behind my left shoulder and tore across my back, inches away from my spinal cord. The second bullet entered directly into my upper back and traveled down to my lower back, once again, inches away from my spinal cord and my aorta. And I was in bad shape. I would suffer from 2 collapsed lungs. My shoulder was dislocated, and those seconds that went by, I didn't know if I was going to live or die. And when I finally woke up in the hospital with tubes down my throat and listening to the hospital monitor beep and seeing my family inside of this emergency room, everybody was crying. And I remember thinking to myself, what are they crying about? Because it still didn't hit me that I had actually got shot. And then I remember Dr. William Marshall from St. Francis Hospital came over to my bedside and told me that I got shot. I suffered 2 gunshot wounds. And that's when it really hit me. I really, thought to myself, would I ever play basketball again? And then my second thought was, would I ever be able to walk again? And it was the worst time of my life.
Aswad, you were able to recover when something like this happens to some individuals. The first thought might be retaliation for ruining the path that you were on. How did you get past that thought?
When I was released from the hospital, back into the same community where I got shot at. That's where my mother lived. And so when I was released from the hospital, I was in immense physical pain, emotional pain. Nobody told me, how to deal with the aftermath of being a victim and surviving gun violence. So I remember those cold nights of waking up in sweats. I was in a state of depression, suffering from post-traumatic stress disorder, with no help at all during this recovery process. And so I started to get angry. Those young men that shot me, that ended my basketball career, I wanted those individuals, to feel the pain that I was feeling. And I had thoughts of retaliation. But today I know that retaliation is what keeps the cycle of violence going on in communities. And so, as part of my healing journey, was being part of the Sweetest Land. It was the only opportunity that I had to talk to someone about what I was going through, what my family was going through. And unfortunately, when I was released from the hospital caseworker or social worker department never followed up with me. Law enforcement came to visit me several times in the hospital and when I was back home. But not one time did they ask me how I was doing. Not one time did they ask me if I needed any help with counseling or therapy. Not one time did they tell me that there's a victims compensation program to help families like myself. Not one time did they care enough about my well-being. And there I started to feel alone. I started to feel like I was the only person going through this. But unfortunately, I wasn't. In my immediate family, my father was shot in the 1980s in his chest. My second oldest brother was shot in his back in early 1990s. My first cousin was shot in the early 2000s. He's now paralyzed from the waist down. And so in my immediate family, 5 out of the 10 males are victims of gun violence. And unfortunately, none of us received any help or support after those incidents. And so I wanted to find a way to tell my story, and the only outlet that was there was the Sweetest Land. I didn't want to become just another statistic, another young black man in Hartford is shot. I wanted people to know what happened to me. I wanted the people to know what I was going through. I wanted people to know that, I was a college graduate. I was a star basketball player. And I've never been in trouble, and my dreams were shattered because of violence. And I wanted to dedicate my life to helping other victims of violence get access to the support and services that they need.
Aswad, today you're managing director of Crime Survivors for Safety and Justice. That's a national network that aims to bring crime survivors into policy discussions. Again, you're joining us from WABE in Georgia. This is Where We Live. I'm Lucy Nalpathanchel. Aswad Thomas, one of several stories, people that we meet in the documentary film, The Sweetest Land, directed by Jeff Teitler. He's with me in studio as well. We're going to continue talking about this documentary that looks at the epidemic of gun violence in the country. It's focusing in on stories here in Hartford, Connecticut. You can join our conversation, 860-275-7266, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel.
We have to realize where we are, where we have a disease. And we have to be able to sit down and honestly deal with it. But who's really watching the hen house, Is it the fox?
That's trauma surgeon Dr. Schuster Christie at St. Francis Hospital and Medical Center in Hartford. He's one of several doctors featured in the documentary called The Sweetest Land. It's a film that looks at the epidemic of gun violence by focusing in on Hartford during a time when the capital city was dealing with a high number of shootings and gang violence. The director is in studio with me, Jeffrey Teitler, who's also an associate professor of communication at CCSU. And joining me now in studio is another individual that we see in the documentary. Dr. David Shapiro, who's a trauma surgeon at St. Francis Hospital and Medical Center in Hartford. David, welcome to the show.
Thank you for having me.
When we see you in the film, you're actually responding to a shooting victim, I believe, Mr. Luis Torres, and you're trying to save his life. What was it like to be doing your work and having Jeff Teitler there filming you?
At first, it was it was obtrusive. It was there. He was right in front of you. But after about the first 10 minutes, Jeff found a way of making himself invisible. And when we're focusing on the patient, that's all that matters. And the nursing staff, the physician staff, all the providers that were there just let Jeff blend into the background, and he became part of our day. So we were able to focus on the patient like we were supposed to.
I asked Jeff earlier about how he got access to these very emotional scenes. You were also an artist in residence at St. Francis Hospital.
Not at the time. This actually began that process because of the relationships that were formed and the stories that were told. But that wasn't in play back then. And I think it was a year-long negotiation with the hospital and following many, many protocols and a number of trainings to be able to do that work.
Well, how did they first respond to you? You said that it took a while to get that authorization. What were they worried about? Patient privacy being one?
So I think that would be a big one. I think patient privacy, you also have to think, what's the get for a hospital to allow a filmmaker in on this issue? And it sort of speaks to that hospital's values that they would allow that access to tell these stories. And again, it was a slow process, and it required a lot of persistence, a lot of follow-up. But the more I ended up speaking to individual practitioners and the more we ended up speaking to it and forming relationships, it just began to snowball. And I remember that first meeting with the trauma team and introducing this idea. And by that time, I was with the police, and I was filming all of these stories, such as, the 2008 West Indian Day Parade, where Richie Medina
This is a police detective.
Yes, Detective Richie Medina finds himself with a 6-year-old boy with a gunshot to his head, and that was Tyreek Marquez. There were bullets going, and he removes his shirt and puts it around Tyreek and holds Tyreek's head. He takes Tyreek to the ambulance, and the ambulances were all jammed up because there were many people injured and shot that day. And he ended up commandeering the ambulance and taking him to the hospital. So to have that outside access and to not be able to follow through with those stories, you want to sort of follow where those stories go and who those people are. And I think the more I was gathering those outside stories, and then the more we met with the trauma team, they became very passionate about it because they are the ones that are waking up at all hours and are there in any weather, in any condition.
David Shapiro, tell us more about the trauma team that you're part of at St. Francis Hospital. And at that time in 2008, how often were you treating shooting victims?
Oh, gosh. So 2008 was a busy time, and probably one of the reasons that Jeff got involved and the police were getting involved in more and more activity. It was every day. We were seeing people with gunshot wounds of a variety of severity every day of the week. And it was in the middle of the night. It was during the day. It was in the mornings. It was any time they would come in. And being a trauma center, we're a level 1 trauma center in Hartford. We're very proud of that fact, but we've always been at the ready, and the trauma team means that you have trauma surgeons, you have PAs, you have nurses, you have respiratory therapists, pharmacists, you name it, in the emergency department, in the operating room, everywhere, in the ICU, ready at any moment to take on all the burden of multiple patients coming in. That's a challenge for anyone, and gun violence is a public health phenomenon. We see it in families, as Aswad just described. We see it having being impacted by prevention programs a little bit, but not enough. We see it impacted by the readiness of any hospital. We can do the right thing in the hospital. What we lack in doing well is the prevention before the shooting and the preventions in subsequent shootings.
In your time as a trauma surgeon, frustrating at times to see this cycle of violence and the repercussions in your hospital?
Absolutely. And it becomes almost a burden to focus your energy away from the patient because you want the patient to get better. You take care of them the best way you know how. But we can't blame the victims of violence. We have to blame ourselves. We have to blame our government. We have to blame our legislative process, that we have to get focused on what can prevent things. And, I mean, the Dickey Amendment's been around since '96. We haven't been able to use funding from the government to focus on gun violence. And even now, after some recent legislation changed, the CDC can do research, but they can't use allocated funds from the government. Well, it's kind of the same thing. You have to have the money to do the research, and you have to focus on the right way.
We wanted to talk more about this issue, this looking at gun violence in America as a public health issue. Joining us now by phone is Linda DeGutis, who's the former director of the National Center for Injury Prevention and Control at the CDC. She's currently an adjunct professor at the Rollins School of Public Health at Emory University. Linda, welcome to the show.
Thank you. Thanks for having me.
We heard Dr. David Shapiro talking about how gun violence, whether it's happening in Hartford or any community in this country, it is a public health issue, but not everyone sees it that way. So in your time at the CDC, what needed to be done to help change the public's perspective on gun violence in America?
I think we needed people to realize how many people die from gun violence, and there's 90 or more people a day who die from gun violence. About 60% of those are suicide, but there's still people dying in our cities. There's people dying in rural areas. There's children dying who pick up a loaded gun because of curiosity, and they unintentionally shoot themselves or someone else. And so this is a big issue. 33,000 people a year were dying of a virus or something that was transmitted. We would immediately be putting a lot of money into it and doing something to figure out how to stop it. But this has not happened. The politics have interfered with the ability to do anything and to get any funding to both look at what works as well as to really implement programs that will prevent the violence from starting in the first place. And that needs to happen at a very young age, but also, we need to be giving people opportunities to get their education, to be able to support themselves. There's so many, contributions to violence. And I think some of it is that people don't understand the stories. They don't understand how this impacts families, because maybe it's not impacted their family. They don't understand. They don't have the stories. And I think one of the very important things about this film is that it does tell the story, and it tells the story from a very personal perspective, from how it impacts both the person who's been shot and their family, how it affects their communities. And I think we've not heard those stories in quite the right way to help people understand it.
Linda, there is evidence when policymakers, when public health officials come together and they see a public health issue before them, there's ways to solve and to keep people alive. One being how, car safety and the number of people that die in car crashes each and every day. There's evidence that when different people come together, changes are made to help people be safe. Can you tell us how that happened?
Sure. Yes, with cars, we knew that it wasn't just about the person driving the car, but there were things that could be done to make roads safer, to make the vehicles themselves safer. So if you look at what has been done with vehicles and with some laws like child passenger safety laws, the child restraints that people now use for their infants and young children, that save those lives and help prevent injuries, airbags, designs inside and outside of vehicles that are safer both for passengers and pedestrians. crumple zones in vehicles, ways that keep the vehicle from creating more injury if it is in a crash. And those are the kinds of interventions that we've developed and we've been able to use to help make motor vehicles safer. We didn't take them off the streets because they were causing death. And I think we have that same thing, with guns. It's that there's a lot of people, most gun owners are very responsible. There's people who hunt, there's people who target shoot. But the thing is that we haven't really set it up so that, given that there are guns in our environment, that we're keeping people safe and decreasing the risk of being injured or killed with a gun.
This is Where We Live. Today we're focusing in on a documentary called The Sweetest Land. It looks at gun violence in America by focusing in on stories in the city of Hartford. On the phone with me, Linda DeGutis, the former director of the National Center for Injury Prevention and Control at the CDC. In studio with me is the director of the film, of The Sweetest Land, Jeff Teitler, and Dr. David Shapiro, who's one of the many people featured in this film. He's a trauma surgeon at St. Francis Hospital and Medical Center in Hartford. David, as you hear from Linda, again, you're on the front lines treating people who have been shot. She mentioned how guns has been politicized in this country, mass shootings in recent years, bringing attention to gridlock, whether it's in Congress or even in Connecticut. We've seen change, but that doesn't happen in all states. So how can medical professionals respond to this issue when, in some ways, there is that hands are tied because there's not federal funding towards that kind of research?
Well, it's a multi-answered question. I'll tell you that the most important thing we can do as an existing body of people, the medical professionals, is agree to stop disagreeing on what's not important. We're not going to get guns away from people. We're not going to take anyone's Second Amendment rights away. We have to make sure that our focus is on the prevention. And just like Linda said, when it comes to, for instance, car crashes, the best example you can set as a parent is being a good driver. So the best example you can set is being a safe gun owner if you're a gun owner. Following the rules, taking care of things, not to mention the legislation on background checks and making sure that people are doing the right thing, avoiding loopholes that allow people to obtain guns that they shouldn't be getting, making sure that people who have guns are keeping them safe in their homes, locking them up properly, and using them absolutely properly. When it comes to the firearms that are available to communities, per se communities that are prone to violence or communities that have people in them that want to commit violent acts, we have to better treat those people and those people at risk by early in their lives teaching them how to resolve conflict without violence. And that's something that we can't just start over for people who are in their teens. This has to start out before adolescence, when they're very young and they're just understanding how to interact with other people.
We're going to talk about that other theme in this film with Jeff Teitler, and that is looking at prevention programs, helping at-risk youth. But I wanted to ask you, David, given the political climate, again, surrounding guns, you're fully aware last fall when the NRA tweeted that doctors speaking out about guns and gun violence should, quote, stay in their lane. What's your response?
My response is the response of my colleagues. This is our lane. I see it every day. My colleagues at the hospital, my partners, the people that I work alongside with the American College of Surgeons and the Committee on Trauma, all those people believe the same thing. Our job is to prevent these people who have been shot from dying. Our job is to stay in that lane and, number one, keep the people who've been shot from dying, and then prevent people who are at risk for being shot from being injured. And this is our lane.
Jeff Teitler, I wanted to go back to you again. These very intimate stories of shooting survivors in the documentary "The Sweetest Land." Also, we see family members talking about what happened to their loved ones and how they're helping them in recovery. But you also focus in on community groups in the city of Hartford, again during this time period, and 2008 to 2013, is that around the time?
Maybe a little more.
And you're looking at, what's being done to even prevent the violence from even happening. So how did you go about focusing in on certain groups, one of them being Capital Workforce Partners? What did you find?
So before I go into any specific group, it was never my intent to criticize a specific group. But if we look at the national evidence on violence prevention efforts, there was a very, very large study done in the University of Colorado called the Blueprints Program. And I think this was a CDC-funded study, and it revealed, right now, I think the current research is 1,500 programs have been evaluated based on their ability to reduce violence and then replicate those methods with the same population in different areas. Out of those who have been rigorously evaluated, what the evidence shows is only 5% of those programs have evidence of efficacy. This doesn't mean that 95% of programs are ineffective. It means they, at the time of submitting their evaluation, that evidence was insufficient. But even if you up that 20% and you have 25% of programs that are doing the job to the best evidence that we have, using protocols as consistently as possible, that's 75% of programs that are reaching families, or maybe they're not reaching families because there's also skimming involved. Skimming being, are you accepting those truly at risk in your program? Because their chances of failure are greater. So if you don't accept those truly at risk and maybe semi at risk, not necessarily totally at risk, their chances of success may be much greater. But the funds being raised are for those truly at risk of impending violence. So it became a very complicated issue. But in watching how those stories played out at the hospital, in watching what would happen after they were released, and in watching the response of organizations, that became a non-ignorable disconnect. And I think that is the difference between taking somebody's story and that now there's an action there. And again, in talking about failure, it's nobody's intent to run a program that fails. So perhaps you have an executive director who is in charge of a program who needs to raise funds for that program just to keep that program going. And in many cases, there's a substantial amount of funds that they are raising. But maybe that executive director is also planning things based on what they think will work. But is it really the best evidence? Is it, and are they connecting with that CDC research and those protocols and the 5% of things that we know work?
Linda, I wanted to go back to you. Linda DeGutis, former director of the National Center for Injury Prevention and Control at the CDC. So there's definitely tools that people can lean on that's shown in public health to evaluate what works and what doesn't. Is this something that community organizations should also be putting front and center?
Yes, there are tools, and I think as Jeff has mentioned, that's one of the very important things is to look at these things that are working and look at maybe, sometimes they need to be modified slightly for a different population, but that's okay. There's ways of looking at that. But it's also monitoring what's working and what's not working. And I think what we need to really make sure we're doing is we're doing programs that aren't making us feel good, but are actually working for the people who we're working with and who we're trying to empower or create, some sort of interventions for, as opposed to making us feel good because we're spending time doing something. But there's so many ways to evaluate it, and the tools are available.
Well, I want to thank Linda DeGutis for joining us today here on Where We Live. Also in studio with me, Dr. David Shapiro, a trauma surgeon at St. Francis Hospital and Medical Center, one of the people featured in the documentary The Sweetest Land. Dr. Shapiro, thank you.
Thank you very much.
This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. After the break, we're going to continue to talk with film director Jeff Teitler, as well as Aswad Thomas, a survivor of a Hartford shooting. And we're going to be joined by Hartford Mayor Luke Bronin. We're going to find out how the city today decides which prevention programs to fund. What has been shown to effectively combat gun violence? We'll ask Mayor Bronin, and we want to hear from you. Join us. Find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. Now, criticisms over how dollars are spent in Hartford to reach at-risk youth and prevent violence is not unique to Connecticut's capital city. In 2014, Illinois State Auditor General focused on a $55 million program meant to curb gun violence, or gang violence rather, in Chicago and found it was largely ineffective. Now, we've been talking about prevention efforts today after focusing on the new documentary, The Sweetest Land, which looks at the epidemic of gun violence by telling the stories of Hartford residents who've been shot. One of them is with us from WABE in Georgia, Aswad Thomas. We wanted to learn more about violence prevention efforts in Hartford. So Mayor Luke Bronin of Hartford is joining us now by phone. Mayor Bronin, welcome to the show.
Thanks, Lucy. Good to be with you.
I think the good news is homicide rates are down from years past, but there's still many shootings in the city. ShotSpotter, which is a technology that's used, counted nearly 1,000 shots fired in Hartford in 2018, 140 shooting victims. When you look at your city, Mayor Bronin, what more needs to be done to prevent violence?
Thanks, Lucy. First of all, this is a really important conversation. I appreciate the chance to be with you. When I first came in, we had a lot of conversations with the folks who were doing the work on the ground. People like Brother Carl Hardrick, people like Dean Jones, and many others, and asked, what's missing from the set of tools that you have? And one of the things that consistently came up is, we don't have anything to offer, especially the young people that were trying to get on a different path and help find support. And because of that, we created something called the Youth Service Corps, which has grown and, over the last few years, given about 750 young people a chance to get their first paid year-round job, but also get connected to supports, mentoring, and counseling that helps them get back on the track to school or to a job. That's been important. And a number of the kids who are in that program have been involved in or around on the periphery of gun violence. But we also recognize that wasn't going to be nearly enough. And one of the other big gaps is strong reentry support. So we created a reentry center right in City Hall where anybody who's returning to our community from incarceration can get connected to folks who are knowledgeable about navigating the world after incarceration, whether that's getting connected to housing or a job. So that's another piece. The third thing we were doing when we started was supporting an organization called Compass Peace Builders that does that immediate response and intervention work to try to break the cycle of retaliation in the immediate aftermath. But over the course of a couple of years, what I saw firsthand in really distressing ways was what Aswad described, that there was not a sustained support system for people who were victims of violence, involved in violence. So, and this really came home to me about a year ago when an 11-year-old was shot. In the middle of the night, he was outside at 1 o'clock in the morning. He was shot. And I went to his house the next morning thinking I would talk to his family, expecting that he was likely still in the hospital. Nobody was home. And as I was walking back down the street, I see a little boy walking up the street with his arm in a cast by himself. And it was, to me, the most powerful and disturbing demonstration of the lack of supports. And so we quickly pulled a team together inside City Hall in my office with many, many partners around the community, everyone from our education partners at CREC and HPS to Catholic Charities and Center for Children's Advocacy to DCF and the Court Support Services Division and many, many others. And but what we called our rapid response protocol, which really is about immediately reaching out, identifying both immediate needs and longer-term needs, and then trying to coordinate the support that can be sustained to those people, especially those under 24.
Mayor Bronin,
people.
I mean, these initiatives all sound, really positive, but when people watch the Sweetest Land and look at some of the nonprofits that are there to respond to at-risk youth and at-risk communities, one of the big questions is, how do you know that these programs are working? What evidence-based strategies or data are you looking at to make sure that you're directing the resources in the right way?
No, it's a great question, and I think with respect to our rapid response protocol, it's probably too soon to tell. I hesitate to even say this because these numbers can change very quickly, but we have had a significant reduction both in shootings and in homicides this year. We're also seeing a much more rapid rate of solving homicides, which helps take shooters off the streets and helps send a message of deterrence, which is important. But the honest answer, Lucy, is it's probably too soon to tell whether those initiatives that we've built over the last couple of years are really working. But we're determined to move the needle, not just to fund programs. And so we're going to be watching it very, very carefully.
I wanted to bring Aswad Thomas back into the conversation. He survived a Hartford shooting in 2009, part of his upbringing in Hartford, now lives in Georgia. Aswad, as you hear Mayor Bronin explain some of the initiatives on the ground, what's your response?
Yeah, I think the city has to do more. More starts with investing in a different type of evidence-based programs. For example, there are models out there that exist, like the National Network of Hospital-Based Violence Intervention Program is a model for victims like myself who survive a shooting before I left the hospital, that I would have already been connected to a community-based organization who's going to follow up with me at home in the community and help me get access to trauma recovery services. Those services that helps me deal with the PTSD, that helps me deal with the paranoia, the depression. And so victims of violence need long-term care. And also victims of violence need support services that not only help them as individuals, but also help the entire family. And so when I see a city like Hartford, a city that I am from, lived there, became a victim of violence there, still have family members there, there are huge opportunities, to look at models that are working, models that really help victims of violence deal with the aftermath of being a survivor of gun violence or helping those family members who've lost loved ones to gun violence. And so, as an organization that I work for, which is Crime Survivor Safety and Justice, we have been championing a model called a Trauma Recovery Center. A Trauma Recovery Center is a model that's community-based, in partnership with local hospitals, in partnership with, it could be a behavioral health facility that is somewhere in the community that victims of violence can go to get access to clinical case management, a medical management plan, outreach worker, having a single point of contact to connect that survivor to other resources is another model that's out there that's evidence-based, that shows that it works. And also, I think the city of Hartford need to start looking into where are opportunities for more funding to provide direct services. For example, in Connecticut, the Office of Victim Services, is the entity that, primarily work with organizations serving crime victims and crime victims directly. The state has received, over the past 5 years, $100 million in Victims of Crime Act funding. But unfortunately, those organizations that the mayor mentioned aren't receiving those investments from that $100 million. So when you have organizations like Mothers United Against Violence, which are doing great work in the community, have been doing great work for decades, was the only organization that reached out to me after I became a victim of violence. They need support and also resources to help them, connect with more mothers who need that important grief counseling and support as well.
Aswad Thomas, again, now is Managing Director of Crime Survivors for Safety and Justice. Aswad, thank you for joining us today.
Thank you for having me.
I also want to thank Hartford Mayor Luke Bronin for calling in to let us know about some initiatives the city is working on. And Jeff Teitler is here with us, director of the Sweetest Land, the peg to our conversation. This is a documentary that premiered at the New Haven Documentary Film Festival. We'll have information on our website about this film. Thank you, Jeff. Thank you, Hartford Mayor Luke Bronin. Today's show produced by Carmen Baskoff. I'm Lucy Nalpathanchel. As always, thanks for listening.